Hello, I'm going to be talking about the OCO dental implant system. I've been using this system for about the last year. It's the first dental implant system I've found that has all of the parts that I like. It's got an excellent drill system with shoulders. It's got an excellent impression coping system, and the implants themselves are excellent. So this is the kit. These are the pilot drills, and they've got shoulders on them also. So you've got a 16 millimeter pilot drill, 14, 12, and 10, and 8. Now, the shoulder is so great because it stops if you're going through the tissue at the tissue. So if you're using, say, a 16 millimeter drill, then if you're going through the soft tissue, you would use a 14 millimeter implant. Remember, you've got 2 millimeters of tissue, so the shoulder is going to stop on the tissue if you're drilling straight through the tissue. That'd be 16 millimeters of drill, pilot drill length, 2 millimeters of tissue, leaving 14 millimeters of implant. So if you're using a 14 millimeter implant and you're drilling through the tissue, you'd use a 16 millimeter pilot drill. Then this row of 3 drills is for the mandible. The mandible is the hardest bone. The maxilla is a softer bone. So this row of 3 drills is for the maxilla. So in the maxilla, we've got 2.8 millimeter width of drill, a 3.5 millimeter width of drill, and a 4.5 millimeter width of drill. For the mandible, we've got a 3.0, a 3.7, and a 4.7. Now, why is there a difference? Because the maxillary bone is softer. You want a greater width difference between the implant and the drill. In other words, you want the implant to be wider than the drill, the width of the drill. Like screwing a wood screw in the wall, you want the hole in the wall to be smaller or narrower than the wood screw. So since this bone is softer, you want a little greater width differential between a maxillary osteotomy and a mandibular osteotomy. This bone is harder in the mandible, so you need a closer measurement of the width of the drill and the width of the implant.
Okay, good.
Now this is another drill. This is for the 6.0 width implants. And so this is a 5.6 millimeter width drill. And these come in handy if you have limited vertical bone height, say in the maxilla or the mandible. If you have limited vertical bone height, it's all about surface area. And so using a wider implant, you're going to have more surface area. This is for the 5.6 millimeter. This is when this drill for shorter implants, very, very handy. So this is that drill. Now, this is how the OCO system works. You've got these sleeves that go on the drill. See, so each of these is a sleeve. Now, if it's the number right here represents how long the part of the drill is in the bone or soft tissue. So this is one of the sleeves taken off of that tray. Now, these are the basic implant widths. You've got a 3.25, a 4.0, a 5.0, and a 6.0. And these are the depths. These are the lengths of the implants, the OCO implants. Now, this is just how many of these individual implants we have in stock. So this would be a 3.25 millimeter implant. So if you've got a 3.25 millimeter implant, you're going to use a 2.8 millimeter width drill. Think about it, a 2.8 millimeter width drill is thinner than 3.25. So you're going to have a wider implant each time you want a wider implant than the drill. With this 4.0 millimeter width implant, you're going to use a 3.5 millimeter width drill. With the 5.0 millimeter wide implant, you're going to use a 4.5 millimeter drill. And with the 6.0 millimeter wide implant, that's the width of the implant, you're going to use a 5.6 millimeter drill. Okay, so this is the drill. And you see if you measure from the yellow line to the tip of the drill, that's 15 millimeters. If you measure from the shoulder, and this is one of the many things I like about this system, I don't like drill systems that don't have shoulder stops. What's the thing that we worry about most as dentists placing implants? That you're going to drill too deep, especially in the posterior mandible. And so once you establish your depth, you don't have to worry about it anymore because you've got a shoulder stop on the drill. So from the shoulder to the tip of this drill is 12 millimeters. So if I wanted to have a 6 millimeter, if I wanted to drill 6 millimeters into the bone or the soft tissue, now let me talk about that for a minute. If you're drilling straight through the soft tissue, say you've got an edentulous area and you're placing an implant, I like to drill straight through the soft tissue because while the implant is also osseointegrating, the soft tissue is also developing an emergence profile around the healing abutment. If you reflect a flap and just drill straight into the bone, into the alveolar process, and put a flat healing abutment over the implant, then the tissue grows over it. When the patient comes back for the impression after 3 months, you have to re-anesthetize, you have to take a punch and punch a hole in the tissue. The emergence profile has not developed, so you don't know exactly where the tissue is going to be. So if it's a edentulous area, I like to drill straight through the tissue. So in that case, you know, you've got 2 millimeters of soft tissue and the rest of it is in the bone. If I use this 6 millimeter collar or stop, then I know I'm only going to be 4 millimeters into bone. If I use the 8, I'm going to be 6 millimeters into bone and 2 millimeters of the drill will be in soft tissue. If I use a 10, 8 millimeters will be in bone and 2 millimeters will be the soft tissue, so the stop, you see, is going to be on the soft tissue. So that's 2 millimeters, so only 8 millimeters would be in the bone. See, these are the collars. So I'm taking the 6 millimeter collar. Now remember, the 6 refers to how much of the implant is below the collar. So see, I've got, that one's a 6. The collar goes to the yellow line. So from the yellow line to the tip of this implant was 15 millimeters. So if I've got a 15 millimeter total drill length from the yellow line to the tip of the drill, now I've got a 9 millimeter shoulder height. If you've got the shoulder taking up this part of that 15 millimeter drill, that leaves, meaning it's taking up 9 millimeters, then you've got a 6 millimeter final drill length with the shoulder from the tip of the drill to the base of the shoulder. So the 6 millimeters is from the tip of the drill to the shoulder. If you use the 8, that means how much of the drill is apical to the shoulder, the 8 millimeter. So I'm taking that one, putting that on the drill. Now remember, you've got a 15 millimeter drill in this case from the yellow line to the tip of the drill. And so the shoulder portion is going to take up part of the drill. So you have a 15 millimeter total drill length from the yellow line to the tip of the drill, a 7 millimeter shoulder height from here to here, final length with the shoulder from here to here is 8 millimeters. See, this would have been 10, so we're 8 millimeters from the shoulder to the tip of the drill. Once you get the hang of it, it's very easy and very simple. So now we're going to use a 10. So this means that, remember, the 10 is how much of the drill is apical to the shoulder. So the drill, you've got a 5 millimeter shoulder because you've got a 15 millimeter drill. So you've got 5 millimeters from the shoulder to the top of the shoulder section. We've got a 15 millimeter total drill length from here, the yellow line, to the tip of the drill. A 5 millimeter shoulder height, this part. So if that's the whole drill from yellow line to tip of drill is 15, a 5 millimeter shoulder height, that means we've got 10 millimeters length from the shoulder to the tip of the drill. So if you're drilling through the soft tissue, you know you're going to have 8 millimeters into the bone, and 2 millimeters of the drill would be through the soft tissue with 8 millimeters in the bone. I'm going to have more videos on cases that I've done with the OCO system. You'll really like it once you get the hang of it, and my assistant knows this front and back. So that's the OCO dental implant system. It's got all the components I'm looking for in a dental implant system. So that's the Dental Minute. These techniques work, and they work every time.
Are you ready to take your dentistry practice to the highest level possible? Of course you are. Subscribe right now to dentistrymasterclasses.com, where you will get Dr. Cutbirth's greatest work and best cases. Here's what you're going to get when you subscribe to dentistrymasterclasses.com. Incredible comprehensive cases not seen in Dental Minute videos. You will get an organized library of all the Dental Minute videos and Dentistry Masterclasses, comprehensive cases for study and reference, before and after photos of Dr. Cutbirth's fantastic restored cases. And all of this, I repeat, all of this is just $40 a month. This is something you cannot pass up. Subscribe right now to dentistrymasterclasses.com.